Hello, I'm Dr. Jon Steinberg. I'm a consultant psychiatrist and I'm the medical director of the Caloundra Private Clinic, and I'm a consultant psychiatrist at the New Farm Clinic, which are both Ramsay healthcare facilities. Today I am here to talk about old age psychiatry. People as they get older worry particularly about their memory. I think we all worry that as we get older that we don't have a good memory. Even some people throughout their life think they haven't got such a good memory. It's very important to understand that memory problems can be the first symptoms that present with a number of different types of dementia. So that also causes people to worry about their memory because they think if they've forgotten an appointment or forgot where their keys were or forgot someone's name, that maybe they might have dementia. Now there can be lots of things causing memory problems. You might not have slept as well, you might be concentrating as well as you should be, you might be upset about something else that's happening in life. There can be lots of things that cause your memory to be hazy or not as good as it should be. If you can remember something, if you can jog your memory, we would say, to make the memory reappear, then that's a good sign. So basically that's not something we would worry too much about. If you can't remember something for 10 minutes and suddenly someone reminds you of something and then all of a sudden the memory comes back, the memories are there, so that's a good sign. So we don't tend to worry too much about that. If you can't learn new things, that's when we start to get concerned that perhaps this is a sign of something going wrong in old age. So it's being able to learn new information. So we would call it short-term memory. So if I told you a name and address of a man and then 5 minutes later asked you again, could you remember that name and address? And that's a common test we do as psychiatrists. The most common type of dementia in old age is Alzheimer's disease, where the parts of the brain that support memory are dying off or deteriorating quicker than the rest of your brain or rest of people your age. And those parts of your brain aren't storing memories as well as they should. Most dementias, that short-term memory problem occurs early, and then there can be a whole range of other symptoms that happen as well. Now, if you have just a memory problem on its own, that may not be a disease. It may just be that your memory's deteriorating, whether it's just a normal change in old age or whether you've got another illness affecting you that's making you not concentrate as well, for instance. We look at other symptoms or you might have that make you worried. They might be you forget what day it is, or you don't know what time of the year it is, or you can't find a word, for instance. So you know what that pen is, but you can't say the name pen for that item. So you might lose the ability of language to be able to speak and identify things. The other symptoms we look for in dementia or that people might be worried about is there might be a change of character, for instance. So a nice, calm person might have signs of aggression, for instance. And then sometimes physical symptoms occur as well. So as part of a dementia, you might get physical signs and symptoms such as control over your bowels, or your urinary system might deteriorate, or you might not be able to walk as well. So it depends. There are physical symptoms that can occur as well in types of dementia. So we look at not only the memory, but then we look at all the other symptoms that can occur with any type of dementia. When people reach the age of 65, they might have a 1 in 10 chance of dementia. Now we know as you get older, the risk of dementia goes up. So basically, we know that once you're over 85 or nearing 90, about a third of people have dementia. And so the risk of dementia goes up as you get older. Starts off low when you're around your 65 mark, it's about 1 in 10 people, and then it goes up from there. Now, so the biggest risk of dementia is aging, and the rate goes up as you get older. There's a rarer group of people under 65. I think in Australia it's estimated about 20-odd thousand people have dementia, younger than 65. So there are a group of people who will get forms of dementia younger, but the vast majority of people with dementia are over 65, and your risk goes up as you get older. So by the time you're in your 90s, about a third of people have dementia. There is no cure for dementia in older age like Alzheimer's disease. There are some treatable forms of dementia. Thyroid dysfunction, you treat the thyroid function, people's dementia resolves. If you have a small brain tumour causing dementia, treat that, gets better, you can treat that. The vast majority of dementia in old age isn't what we would call curable, but nowadays we know that there are a number of factors that can either delay the onset of dementia or can minimise the effect of the dementia as you get older. One of the protective factors is if you keep your brain active. So we know that people who do what we would call sort of challenging mental tasks, so people who worked a lot through their life, people who do crosswords, people who do Sudoku, people who keep their brains active, can perhaps delay the onset of the symptoms of dementia. So feeding your brain with lots of mental activity is a good thing to do. We know that physical exercise can also help as well, so keep as fit as possible. In the last 20 years, there have been treatments developed that delay the process of Alzheimer's disease. They don't cure it, but they delay the symptoms and reduce the level of symptoms over approximately a 5 or 10 year period. There is a hope in the future that dementia of Alzheimer's type could be prevented or immunised against by stopping damage in the brain, but those treatments aren't yet developed. If you're concerned that you or your relative have dementia or developing dementia, it's very important that you go as early as possible to your GP, and then the GP can advise tests that can be done, both examination of your brain, for instance a brain scan, CAT scan or MRI scan of your brain. They can do memory tests. They can refer you to a specialist in dementia to get a proper diagnosis of what type of dementia you've got. Very early detection and diagnosis is important because you can consider treatments. Not treatments to cure the condition, but treatments to prevent a decline and to manage your condition. Now, the management is very important early on. The earlier you get the diagnosis, the earlier you'll be able to have the option of having some forms of treatment. Now, that treatment might include improving your diet. For instance, some people worry they don't have enough vitamins or they're not eating properly, so your GP can review that. Certain types of vitamins, low vitamin B for instance, might predispose you to dementia. So you need to get tests for that. A GP can work out whether your diet's good. You can be advised about treatment of your blood pressure, for instance, to minimise stroke risk. You can be advised on exercise and lifestyle planning, which is all very important. The other factor that's important is you might be referred to a specialist in either old age psychiatry or old age medicine who can diagnose your dementia and then start a medication that can prevent the decline over time. Those medications are available and can be prescribed by a specialist and then by the GP. The other factor that it's important to talk to your doctor about is planning for the future, such as your will or your enduring power of attorney or your financial arrangements. Some people have guardians or people who look after their financial affairs. It's important you talk to your doctor as soon as possible to start that process, because it's important that your safety and security is looked after in your older age. Dementia can be caused by a number of different illnesses. We think, as doctors, that some of these illnesses may have a genetic risk. Now, when we think about patients with Alzheimer's disease, which is a common form of dementia, there are a group of people who do have a genetic abnormality that predisposes them to developing Alzheimer's in older age. The biggest risk of getting dementia is getting older, not genetics. But there are a small group of people who have a genetic predisposition to Alzheimer's disease. One way to think about if you are at risk from the genetic problem is the age of onset of the dementia. So the younger you are, the more likely that there's a genetic link. So tragically, some people develop dementia in their 30s or 40s. Now they of Alzheimer's type. So they might actually be the group that are most prone to a genetic form of Alzheimer's. So yes, there is a genetic link. It's not been defined exactly as yet, but there is hope in the future that it will be defined, and people will be able to predict the future when they're at risk, and there is hope from that there'll be earlier prevention of Alzheimer's.